You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and health policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, though, my 157th episode, we have a great guest, Paul Ketchel, founder and CEO of MDsave, that's working very hard to disrupt healthcare. Welcome to the show, Paul.
Hi, thanks for having me, Justin.
You got it. It's great to have you here. I'm glad our teams were able to sync up. We have a lot in common in our background, even from our past 10, 15 years ago and to today. So I look forward to diving in. But before we get too deep into MDsave, tell us a little bit about you. Where are you from? Where'd you grow up? All that good stuff.
Yeah, so I grew up in Tennessee, in Nashville, and went to school in East Tennessee in Knoxville, and then afterwards started my career first on Capitol Hill, working for U.S. Senator Bill Frist at the time, and started in health policy work and technology work on Capitol Hill, and then I left the Hill and got into really being an entrepreneur, and I was part of an early biopharmaceutical company and a diagnostic lab company, and then did some, public policy consulting work in between ventures. And as time progressed, just really sort of stayed in that healthcare market. And then, that really led us into this venture, MDsave, which, I founded back in 2012. And so I've been working here since and having a great time in the healthcare industry.
Very cool. So obviously you say Capitol Hill and people go, oh my, because obviously now it's a very interesting time on the Hill, and I'm glad I'm not there too much anymore. But what are a couple of things that stand out in your mind from your time on the Hill?
Yeah, I would say on the negative side, it's interesting when you bring up today is I was there in the middle of the Clinton impeachment trial, and I sort of saw this transition where you had lots of friends on the other side of the aisle. It was a very, open, congenial place. And, by the time that trial ended, cable news had become it passed up the major networks for the first time. And so things had really become about the 30-second soundbite. And I think it was the beginning of the transition from what I think, perhaps the way Capitol Hill once was to the Capitol Hill that we're in today, So I think, watching that was something that sticks in your memory and you get there. But then, and then also, I would say on the positive side of it, I was there in the beginning of the .com revolution, and Bill Frist was chairing several committees in science and technology. He was, I think, the youngest senator in the Senate at the time, and had been a heart and lung transplant surgeon. And so he sort of inherited all of the advanced high-tech issues, just due, I think, frankly, because of the age of a lot of the other senators and the technologies were new. And so I had a lot of those issues passed down to me on the staff. And so we did a lot of first. We had the first website in the congressional branch of the federal government. We had the first two BlackBerries in the United States. And I always joke that Bill Frist, the first night he had one, had sent his schedulers all these messages, and I thought it was going to be really efficient. I asked him the next day, how's it? He said, oh, it's terrible. Look at all these messages we got in the middle of the night. So I think it was the first time where you had someone in constant contact and you saw that happen. So, it was really interesting just being there during that intersection of, I think, science and the technological revolution and all of policy trying to catch up and being written and seeing all that innovation take place at such a young age was a really rewarding experience.
Yeah, and I got to give you guys kudos. I'm sure you're a part of creating this, because when I started working with Frist's office in 2004 and 2005, very technically proficient, not just in their hardware that they're using, but in policy and legislation. They understood healthcare. Obviously, that's Senator's background, but his staff was just always so complimentary in what we needed to get done. There was some really big issues, and they just got behind us and helped us in trying to tweak healthcare where we needed to create a better process. And so I'm sure some of that was from your work. So thank you.
Oh yeah, no, thank you. It was a really rewarding experience there.
So tell us about MDsave. I mean, I'm dying to get into this because there's a lot of, again, we have a lot of touch points on where I'm investing now, where you're conquering. So tell us about MDsave, where the concept come from, and all that.
Yeah, well, I mean, MDsave is a company that really came out of, I was in a venture right when the first drafts of the ACA were circulating and moving into passage. And when I looked at the bill, from a former policy background, and when I just saw sort of the changes with the mandated coverage designs and some of the added coverage of the changes to the risk pools, I just had a really strong belief from doing this a long time that we would see a pretty substantial jump in the premium prices over the years in order to change because of the plan design changes. And as a result of that, we'd already seen the insurance industry moving patients onto high deductible health plans and out-of-pocket plan designs. And we just theorized really early on that this was really going to accelerate that to keep the premium costs down from the small employers and so forth and on the individuals. And so the main genesis behind the idea was patients are now really going to be responsible for that, say, first $5,000 to $6,000 of their healthcare expense out of pocket before their benefits kick in. And that's really the first time that had happened in mass in the United States. And so our view was that now that patients are going to be paying these bills themselves, they're really going to be concerned about what the costs are. And so let's build a technology tool that allows patients to shop, compare, and purchase healthcare the same way they've learned to purchase things like airline tickets or travel or other things online. And so that was really the genesis behind the idea. And so that started the company, moving. And of course, we had to start from ground zero on building the technology infrastructure to drive a transaction like that. We had to build complex technology to involve bundling, and then also the ability to process payments. And at the same time, we were serving a consumer need or patient need. We were also really helping the hospitals in a major, I think, unintended consequence of these plan designs, which was now that patients are responsible for these large payments out of pocket, and the health plan's not coming in until really an inpatient event, the hospitals were really, and the providers were really struggling on collecting those out-of-pocket patient portions. Yeah. There was no real way to do that or defend against it. So this really allowed them a way to do that. So we went to health systems and asked them early on said, look, give us a rate that's better than what an insurer can collect. But, so we get about a 40 to 60% better rate than the insurer for the patients. But in exchange, we collect the money up from the patient and we pay a provider in 6 days or less. And so even though that patient's getting the savings, we're removing all the intermediaries from the transaction. Our providers are actually netting more on the transaction. So it's helping the provider and it's helping the patients along the way.
Yeah, no, understand. So talk about some of the packages that you offer and what types of services that you offer.
Yeah, it was a really interesting experience. When we started this, we thought it would be very commoditized items that people would gravitate to, diagnostic tests, physicals, office visits, things like that. And, we started really early on thinking that everything in MDsave needed to be a fully bundled episode of care. So really what you see is what you get. And when you buy something, you're completely settled and you're not going to get, additional bills and so forth. And so that was really our focus. And so we started with the simple things. So in our simplest world, it might be something like an MRI where you're bundling an outpatient radiology group along with a facility fee. And now we have expanded that over the years. So now we're up to about 8,000 bundled procedures, outpatient and inpatient. And we cover everything from the $6 lab workup all the way up to, $30,000, $40,000 surgeries. And what's been really interesting is surgery has been our fastest growing segment in the last few years, and about 25% of our volume is surgical now, and the rest of it matches everything else. So, I mean, it's really applicable to any of that out-of-pocket spend if you're under a deductible, or on the really high dollar things if you're uninsured or a self-insured employer is paying the bill. So it's just making it a more efficient way to purchase and choose care in the new environment that we're in.
Yeah, I love it. So tell me, and I want to dive into transparency next, but how do you get around, I heard some over the last couple of years, providers, they negotiate a certain rate with payers, but then they can get in trouble if they offer a different rate to somebody else. The payer always comes back to them and kind of hammers them. How do you get around that?
Well, that is a big problem, and I wouldn't say that I really agree with it because I think it's limiting access to care for patients.
Oh, I totally agree.
Yeah, the way we've gotten around it though is essentially you can't. What the insurers say is that you can't have a negotiated rate with us and then offer one-off discounts to patients, because if you do that, you're essentially going to violate these agreements, and that could be your new rate. But in our situation, what we're doing is we're bundling not just that single provider, but all the other providers that are part of that episode into one item to purchase. And then the patient is making a choice to choose, and they're paying cash for that purchase. And by paying cash, you may be using a credit card or PayPal or financing it, but they're making a payment, and they're not running it through the insurance payment. Now, they may want to file that towards their deductible later on, and they can do that. And the insurers have been pretty good at accepting that from us. The insurers like it because we're making that under deductible go farther for the patient, and which is good for the insurer and good for the patient. But the reason it's happening is there's actually a HIPAA provision that says you can give a discount to a patient, or a patient can choose to pay cash, and you don't have to file a claim on behalf of that patient unless you're trying to receive reimbursement. And so it's a cash payment, so it really comes down to patient choice provisions that have allowed us to operate in that free market system. And so it's a little bit of a myth that, you can't have a discount, but a patient can really pay cash and go anywhere they want. They have that option under HIPAA and consumer protection laws. So, that's a little bit of a myth, but it does become a problem if you're billing different insurance rates and you're contracted.
Yep. No, I understand. So let's dive into transparency, because I think that you and I are both extremely. I'm personally a very big supporter of much more transparency and full transparency in healthcare costs across the board. I don't care if it's Medicare, I don't care, private payers, all of that. I've been pushing for it for years, testified on Capitol Hill on it. What are your thoughts on transparency? And if it's important, why it's important?
Yeah, I have mixed thoughts on it. And so I feel that, number one, I do think it's important. I think that patients should be able to know what they're buying, what they're getting, and be able to make an informed choice. And I think it's insane that healthcare is the only industry where it has been an acceptable practice to basically have something done, then someone tells you, well, we hope you enjoyed that. We're going to send you a bill, and you'll know how much that is 4 months from now.
Right.
And so I think that's a strange scenario that we've become accustomed to living under. However, I believe that transparency is, first of all, it is valuable. I believe it's valuable if it's actionable, meaning, and that was one of our real sort of cornerstones was this. How much does it really help a patient if you show them a price that patient cannot access anywhere? And so our goal was always to make something that if you could see it, you could buy it in real time too. I think there's some value in transparency on informing the consumer if you can show them prices and at least let them know a ballpark that they're operating in. But I have mixed feelings about it too, because, a lot of transparency I think has been hijacked. I don't believe it's transparency when you display a bunch of rack rate charges to patients, which is not a real number that the provider's going to get paid, the payer's going to accept. And I think that almost, a lot of folks have responded to transparency legislation by doing exactly that. And I think that just causes more confusion in the market. And I also think it causes headwinds for folks that like us that are really trying to innovate in that space, which, makes people not trust some of the data they're seeing in things when you have, a lot of bad data out there. So, I think it is vital to improve the patient experience, but I think how it's done is really important, because I think you're really straddling a line where you can make it worse, not better for a consumer or patient.
Yeah, no, I love it. And I love the thought on making it actionable, because I agree. If they can't do anything with it or it's not relevant, then transparency could actually be a problem and create more headwinds. So I completely agree. And for those joining us a little late, my guest today is Paul Ketchel, founder and CEO of MDsave. So let's transition a little bit over to the Amazon merger. I get asked this question all the time. What is all this Amazon's activity in our space? What's your thought and relevance to what they're doing, and then also maybe what you guys are doing over at MDsave?
Yeah, I think that anytime we could see big market players moving into this space to drive healthcare, I think in the direction to make it shoppable or more transparent and reduce savings and bring market forces into place is going to be helpful. When you look at Amazon, I think, there's a few places I think they could make a pretty big impact. I mean, I have my views on it are, if you look at Amazon and JP Morgan and, the other employers who have joined into this collaborative effort, it's still only, over a million lives, which is not a big enough number of lives today to really move prices in the healthcare markets. However, I do think there's some areas with their infrastructure that they really could make some immediate impacts, and one I think is going to be in the pharmacy side, by the playing in the PBM space, and being able to ship pharmacies direct and use Amazon's distribution power to do that at a lower cost and a more efficient way. And I think that's one area where you can really bend the cost curve on some of the employers. I think when we get into the idea that we're affecting the mainstream healthcare yet, I think this block of employees is probably not large enough to really move that needle much. But, what I'm hoping is that in the end of the day that you'll see this will be a beta test with these employees. They can figure out how to get this right. And over time, if they can get that right, then roll that out to, larger groups of members. And like, for example, I could see an Amazon Prime Health membership, and you can shop and buy in confidence on Prime. So I think that could be really beneficial. But, right now I think the pharmacy will probably be a big impact, but I think it's probably going to be a harder road than some think, even for Amazon to dive into, I think, right off the bat.
Yeah. No, excellent point. I totally agree. We have 330 million people in the country, and plus, and so I agree. But it's a good starting point. It certainly gets everybody talking about it and focused on how do we reduce healthcare costs, how do we just basically begin to tackle this issue and get some big brains on the table to do that. So I agree there too.
Yeah, I mean, I think when you look at the size of a large health plan today, when you have 30, 50 million members they're negotiating with, I mean, It's even been hard for them to be in the cost curve. So I think there's going to be a lot more lives, but I think you're right. If you can get those folks in there and thinking about it, and, I think that as the market from a technology standpoint is catching up and healthcare is becoming more of a commoditized item in the minds of the American patient/consumer, you can really see their market forces being brought to bear in the future. And I will say this openly, though I think it's going to be a little bit longer than some of us think, and a little bit harder for those organizations. I do see a day where Amazon will probably be your biggest aggregator of healthcare services, or another large consumer tech company, I think, will be, versus the traditional pathways that we've operated under.
Cool. No, good thoughts. So talk about a little bit your corporate strategy. You guys focus on individuals, corporations. How does your model work in that capacity?
It's a little bit of a mix. So we only have two core patients, or two core customers, I should say. So one of those is the healthcare systems. And so we sell directly to large healthcare systems, a single contract that allows them to offer unlimited number of bundled services direct to consumer via our platform. And it allows them also to offer those bundled services to all their owned and affiliated providers as a benefit under that contract. And so we do that so that we get large networks. So we get a lot of premium brands. We're 7 of the 10 largest, integrated health networks in the country today, and many more. But what that's done is you're allowed to bring all those providers in. And so not only you're getting hospital-based services, but you're getting those in-office services, and you're getting those outpatient service groups and labs and diagnostics and all those things in a market, which really gives the consumer area. And our value prop to them, as I sort of mentioned, is, we're getting a better rate, but we'll pay you at 6 days or less with no claims to file and guarantee zero bad debt. And so the hospitals are really looking at, this is a modern rev cycle way to respond to the out-of-pocket payments and patients who want to pay cash. And also our technology takes that bundled payment and automatically unbundles and adjudicates that payment to all the individual providers, so that no provider has to be in charge of that payment, which has been a real hurdle to bundling with a lot of organizations that have tried to go down that path. And then on the flip side of that, we market directly to consumers, and we market to individual consumers. We market to self-insured employers who are paying and other channels. And we're even starting to do some work with some of the insurers and payers on out-of-pocket plan design products and ways to enhance that experience for members. And so it's a mix on those patients. One thing I would say that's really, I think, unique about our journey is that coming from healthcare and healthcare technology, I had a real vision, which was I did not want us to build another ugly healthcare tech product to push on patients. So we went out to California and brought in a team of consumer tech engineers who had no healthcare experience whatsoever to try to replicate a true consumer experience. So, like, for example, our VP of product was he was VP of product at CNET, and our CMO was Chief Marketing Officer of Pottery Barn Online. And so we brought in groups from other industries to really focus and build tech-savvy products that consumers would like and use. And it's been really successful from that standpoint for us on the consumer side of things.
Very cool. How many patients do you guys have that you today in your portal or on your website that you guys manage or help?
Yeah, so it was slow when we started growing, and give you an idea. So as of last year, we had done about 69,000 direct-to-consumer patient transactions. In this year, we'll do about 125,000 in 1 year of consumer patient transactions, and we're seeing about somewhere between about 15 to 20% growth month over month on the patient volume. And but again, I think we're really in the infancy of this direct-to-consumer health, and what's really been, I think, an interesting thing to watch with patients, and something that we've been really proud of, is that we survey all our patients after purchase, and our patients have, with MDsave, we've had a 91 net promoter score for patient satisfaction, which is sky high in the healthcare industry. And what I find that's really fascinating about that number is a lot of the health systems we work with have NPSs in the 40s. A lot of the health plans are in single digits and some negative. And if you think about our patient journey, after they've made that purchase, they're still going to the same provider offices. They're still seeing the same physicians. They're probably having very similar outcomes, but they're that much more satisfied, which I think shows you how important knowing a price up front and putting the power of choice into the consumer, how much that means to them mentally in their healthcare decision-making process. And so it shows you that I think the market is really ripe for disruption in the direct-to-consumer space.
Couldn't agree more. Awesome. Here, I have a couple more questions to get to in our remaining 2 minutes here. So it's like a 45-second answer, kind of lightning round. And in my closing statement, I always ask these two questions. So where do you invest your time, talent, and treasure, and why?
Yeah, so I invest my time in healthcare innovation, is where we are. And I think I think it's best to do what you know, and that's where I think I can make the biggest difference. My wife is really the philanthropist in our country, in our family. So we co-chair a lot of events. So we just did one for Vanderbilt Children's Hospital to add like a new wing there for long-term care. So we try to sort of stay in that healthcare space and have those opportunities in Nashville. And for inspiration, we have a nice house in a boat in the low country. I got into boating really young, so I really like to be on the sea and be on the water when I'm given the time to get away.
Sure. So is that your favorite place to get or be inspired, or what is your favorite place to get or be inspired?
Yeah, so I like, as I mentioned, I think for us, we like to get down and go out to South Carolina or anywhere on the ocean. Sometimes we sail in the Caribbean and things like that. So, for me, it's always water is the one place where I'm always able to sort of disconnect and come up with new ideas. And so I try to, if I can, between business, get away, try to spend some more time down there.
Yeah, I completely agree. My two things are water and the Bible. They're my two places where I really can kind of recharge and just be inspired. But I love the ocean and air too. Awesome. Well, Paul, great to have you on the show today, and I truly appreciate you taking time out of your busy schedule to join us. And thank you to everyone for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific to hear our latest shows. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. You can also check out the new website that we launched at justinbarnes.com. Thanks, everyone. Have a terrific week.